Welcome back. All right, Natalie, I have a riddle for you. You ready?
Okay. Ready.
What's bigger than a bread box and can make spines, hearts, and other lifelike body parts?
I'm not sure, but I know who's going to know the answer. Our dear friend, Dr. Jen Arnold, who we're always excited. She makes time for us to be on the show, of course, coming to us today from Johns Hopkins All Children's. Dr. Jen, how are you?
I'm doing wonderfully. How are you doing?
Oh, I'm stuck with this riddle now. Help us out. Answer it for us.
That's a tease. That's a good tease and a good pitch to say, wait a minute, what do they have there?
I know. I'm going to have to use that, by the way. I love that, Charlie.
It actually came from your team, so you go ahead and take it. But yeah, tell us about the answer is this 3D printer, which I feel like there has been so much buzz about. But I didn't realize that this could be so helpful for you and your team, Dr. Jen.
Absolutely. We're thrilled. We have a new member of our simulation family, and that's our 3D printer. And what's great about the 3D printer is we can print patient-specific human anatomy. And what that allows us to do is it helps us to educate, to train other clinicians like surgeons and trainees like fellows and residents. But it also allows already experienced providers to identify complications that they may experience in the OR before they're in the OR. So let me explain. This is a 3D printed skull, one of the many types of human anatomies we can print. This is a real patient, a baby, who has been born with something called craniosynostosis, which means this top bone here is fused. It's not supposed to be fused in the newborn period. And so when a baby is born with that fusion, it can make the head size developmentally abnormal. So as the baby grows, the head shape can be abnormal, and that can cause neurologic problems. And so our surgical team, our neurosurgeons, need to fix that. And that's a complex surgery, as you can imagine, on a baby. And so one of the things that we can do with 3D printing is we can take the CT, the MRI of that patient, and we can print out either just the skull or even now with this new printer, skin overlaying on top of the actual skull, the actual human head. And so the surgical team can rehearse and identify potential complications before they're actually in the OR and practice that surgery for that patient. So it's pretty exciting. It's a game changer when it comes to healthcare and our ability to provide better outcomes for our patients.
Jen, I'm curious. It seems like, you'd think a blueprint or some kind of like computer program would just go into being able to tell a printer what to print. Are you able to work off of actual cases, actual pictures or MRIs or things of patients to make this happen?
Yes, exactly. And that's exactly how it works. We take a CT scan or an MRI. Obviously, it has to be a certain type of MRI scan that allows us to take the information, the data from that scan, go through a process called segmentation, where it then puts that information into something the 3D printer can read and then output into a live three-dimensional print.
Wow. So it's so fascinating to me because I feel like us as TV hosts with a very unimportant job, I say that lightly, we've had to adapt in this virtual, like we are learning new ways of producing a TV show. How has this changed how you handle medicine and what you're able to do in your simulation team? I mean, as you said, it's a game changer. It's got to be huge.
No, this is really exciting. If you think about, especially in the world of pediatrics, when we're training staff or a surgical team how to handle a crisis in the OR, we not only can allow them to practice the procedural part, the surgery, but we can even help improve teamwork and communication and patient safety, because now, instead of a surgeon just sort of standing over a very low-tech mannequin and saying, okay, now I would be operating, well, we can actually have that whole team in an OR setting caring for a patient, right, a simulated patient, and actually get to do what they would normally do. They get to do surgery because we have this technology. And so that really does change the way we're able to train staff. And we know medical errors today are usually due to deficiencies in teamwork and communication. And this allows us to really practice even those skills because we have the technology to make it a more realistic situation for our surgical teams.
Jen, I think when we've talked with you before about how you are the director of the simulation center there at the hospital, I always kind of pictured it, and I'm learning this might be my mistake. I've always pictured you kind of working with doctors prior to when they actually, start their practices, and then they're busy with that. it sounds like that training is always a part of what you're able to do at the hospital, and you learn about specific cases. Case in point, what you were able to show us with that child.
Absolutely. Simulation doesn't end after you're done with your training or your school. Simulation is really meant to help all healthcare providers maintain skills, enhance their skills, overcome very difficult situations. Healthcare is a stressful place, and every patient is unique and every crisis is unique. And so without simulation-based training, we can't be as prepared as we should be, right? If you think about sports players, they warm up, they practice ongoing regularly all the time to be on their A game. And simulation, especially now with technologies like 3D printing, allows all of our healthcare providers to really be on their A game too.
Well, and I'm so happy to hear that this has continued even in this COVID-19 world, where I feel like so much of the tension has been on that we know that other things, because other health related issues are still coming up. So I'm so happy to hear that you're able to still train and work on other areas of healthcare, that it hasn't seemed like that slowed down.
Yeah, no, I think one of the things that COVID has brought as a challenge is we do try and do as much as we can, virtually. We've done a lot more virtual simulation-based training. But we still do in person as well. Procedural skills, thankfully we can set up a space and you can be socially distanced. When it comes to teamwork skills, if it is high priority from a safety perspective, we put on all our gear. We train like we fight, right? We put on the N95 and the face shield so that we're protecting each other from each other, but we're still practicing because we know in the clinical environment, we're going to be working together just like that.
Oh, Jen,
Right, Dr. Jen, we're out of time.
Yes, we always learn so much from you. Thank you for being with us as always. Take care and hugs to that family of yours.
Thank you. You too. Be well.
Bye, Dr. Jen.
Take care.
Oh, always fascinating to talk with her. All right, stay right there. We'll be right back.